Welcome back. Foreign Affairs Minister Dr. Vivian Balakrishnan says it is important to coordinate global efforts to health crises amid climate change and misinformation. He noted new challenges with funding now more unpredictable, especially with at least 2 countries leaving the World Health Organization. There has also been no progress on a pandemic treaty. Now, he was speaking at a summit on infectious diseases.
The next healthcare crisis is inevitable. And, what is most painful is not just an emerging pandemic, but the unnecessary loss of lives because we didn't do what needed to be done, both in terms of prevention and action when the crisis actually emerges.
Dr. Balakrishnan adds domestic infrastructure must be strong too, citing that Singapore has strengthened its disease surveillance systems, which can be used for the region. Singapore will also continue supporting the WHO as well as global scientific data sharing. And for more on the next possible pandemic and the global cooperation needed to tackle it, we now speak to Professor Tikki Pangestu. He is co-chair of the Asia Pacific Immunization Coalition. Professor, welcome to the program.
Pleasure to be here.
So I would like to start by asking you about your concerns. What keeps you and your colleagues in the field of infectious diseases awake at night?
What keeps me awake is the appearance of a new virus or bacteria that spreads rapidly, maybe through the air, which causes severe disease and deaths, and happens in an area where the healthcare facilities are very limited, for example, in the developing countries. That's what keeps me awake.
As our Foreign Affairs Minister said, the next healthcare crisis is inevitable. What warning signs are you watching out for in terms of new infectious diseases and the next possible pandemic?
Yes, I agree with Dr. Balakrishnan. It's a question of when, and it's not a question of if. The 2 warning signs that I look for are mutations that are happening in a particular virus, like we know very well the different variants of the COVID virus. So that's one. The second warning sign, as you know, many of these viruses come from animals. So the second warning sign is when a virus comes from an animal which was previously not known to be carrying that particular virus. And that seems to be happening at the moment in the US with influenza virus coming from cows, which was never before a major animal in the spread of influenza virus. So that's a cause for concern. If I had to make an educated guess where the next pandemic is going to come from, and a lot of experts agree with me, it'll be a flu virus. Of course, it's possible. It could be a new variant of the SARS-CoV-2, COVID-19 virus. But I think most public health experts would put their money on a flu virus being the cause of the next pandemic.
Why do you say that?
Because influenza spreads very rapidly. It changes, is able to mutate, and it is carried by many, many different animals, both domestic animals like chickens, pigs. It is also carried by wild animals. So it's got a very widespread distribution all over the world.
Okay. And we saw how the COVID-19 pandemic unfolded in recent times. What have we learned from that experience? What gaps need to be closed, do you think?
I think, and I think Dr. Balakrishnan had said this before, the most important thing, there are basically 3 important things. You need your healthcare system to be well prepared for an increase in severe cases, including ventilators, oxygen supply, etc., etc. You also need to be, to make sure that your healthcare workers are protected. So that's about the healthcare system. The second one is good governance, a coordinated response, whole of government, whole of society. And the Singapore Multi-Ministry Task Force is a wonderful example of good governance. The third one is social capital. You need the people to trust the government and basically carry out what the government is recommending, which is based on good scientific evidence. So these are the 3 pillars.
Okay, and there was an infectious diseases summit today, as we've already mentioned. It called one of our era one of polycrises of pandemics, climate change, misinformation, geopolitics. How challenging has it become to manage healthcare in such an environment like this?
Okay, I'll just give you one example from misinformation.
Yeah.
Okay, when Singapore was trying to ramp up vaccination to prevent COVID, okay, there was a lot of misinformation, fake news going around about the vaccine. Oh, it was developed too quickly, it is not safe, it has long-term side effects, etc., etc. So that meant that a lot of people, because of this fake news, were hesitant to get vaccinated. Now, that, of course, is a big problem because it means that you cannot maintain a high level of vaccination coverage. So misinformation is a real issue, and we need to overcome that in the future.
And what else needs to be done to help us face some of the other challenges, Professor Pang?
Okay, I think the most important one here, and it's already mentioned, is global solidarity, international cooperation with other countries, sharing information, working with the WHO, for example. And at the country level, political will and commitment and sufficient resources, and putting in place planning for the next pandemic. Not to do it later, but to do it now when there's a bit of a, like say, a quiet period after the COVID pandemic.
All right, great words there, Professor Pang. Thank you so much for coming in to speak with us. Professor Tikki Pangestu there from NUS Yong Loo Lin School of Medicine.